Today we're going to cover a specific item from the OASIS, M2020. I want to start by asking, Tina, what does M2020, which is management of oral medications, entail?
Hannah, this includes all oral medications, whether that is prescribed by the MD or over-the-counter medications. It's also important to keep in mind the exclusions, and that's injectables, topicals, and IV medications.
When assessing the patient, you want to remember to assess their physical ability and their cognitive ability to take the correct medication in the correct dosage at the correct time.
Okay, what if the patient takes most of their medications appropriately, but they have trouble following instructions for Coumadin?
This is a really good question because when considering M2020, the answer should be based on the medication that requires the most assistance. So in this case, if they take 10 medications and 9 of those medications they can take independently, you would normally mark this patient a 0. Since they require assistance with the one medication, which is the Coumadin, you're going to make them a 3.
What happens if the patient does not have all of the discharge medications in their home after the hospitalization at the time of the start of care or the resumption of care visit?
Great question, Hannah. In simple terms, if the patient is sent home on 3 new medications, but only 2 of them are found in the home, you cannot assess the patient's ability to be independent with a medication that isn't present. So if all the medications are not found in the home, you have to choose response 3.
That's a great point, Stephanie. The coder also needs to consider when answering M2020 that this encompasses the ability to ambulate safely, retrieve the medications, and access the glass of water to take those medications. So when you answer M2020, you need to keep M1860 in mind. And the reason for that is because of the ambulation piece. So say M1860 is scored a 3, this patient requires assistance to ambulate, so that would make M2020 automatically a 3.
Okay, no, that's great information. Thank you so much. What other considerations do you think need to be made regarding this item that we haven't talked about yet today?
A final reminder is that we need to remember this patient is being assessed on their ability before the clinician implements any strategies or any type of training or interventions for the patient. Those will be assessed on the discharge OASIS, and at that point, the agency can demonstrate improvement then.
And also, the coder should carefully evaluate the level of assistance for oral medication management. This is to ensure accurate coding of M2020. This is going to support quality patient care, and it's also going to ensure maximum reimbursement under the PDGM model.
Well, thank you guys so much for sharing these tips in this coding corner with us.
Thank you, Hannah.
You're welcome, Hannah. Thank you.